Well, good afternoon or good morning, depending on where you're at. My name is Dr. Elena Rios. I'm President and CEO of the National Hispanic Medical Association, and we're happy to co-sponsor or co-host this webinar with We Can Do This, a campaign of the U.S. Department of Health and Human Services. We're very happy to call our webinar today, Enhancing Prevention Strategies and Health Outcomes Through Bilingual COVID-19 Resources. And I just wanted to give a couple of housekeeping announcements before I announce the speakers. All participant microphones will be muted, but please feel free to type your question into the Q&A box for the panelists to address during our Q&A session at the end. And just to remind our panelists not to answer by typing in your answers, because we would like to have a discussion at the end. Please fill out the short post-webinar survey that will be emailed out after the event and also shown as a QR code at the end. And raffle prizes are available upon completion of the survey. A recording will be housed on the NHMAMD.org website and sent out 1 week after the event. You can also find this on our YouTube channel. And we are on Facebook Live also. Next slide. We do have continuing education credits from a Medco. We have the acknowledgement of financial support that there is no conflicts, and it is a 0.5 credit for doctors and other health professionals. Next slide. And just some updates. The National Hispanic Medical Association is proud to host our Vaccinate for All updates. We are supported by CDC's Center for Immunizations, and there is a definite public health emergency that we have been under with the COVID-19 pandemic, and the administration has set the date to end the emergency on May 11th. And just to let everyone know that we're very aware of the states across the country have all been given the, I'll just say the instructions on developing their planning to get more communication out to all people across the country about the public health emergency ending. And for our communities, I think there's a couple of things that I'd like to say that NHMA is very interested in helping to get the word out, especially to people that are in our communities that are on Medicaid, because Medicaid will be changing their rules. You will have to be applying every month to month to month, as it was before COVID-19. And a lot of people may not be aware that they will be losing Medicaid if they're not eligible. The other thing is, we're going to start seeing people having to pay for vaccines and treatments that we're going to talk about today. And we just want to be sure that people start getting the word out. And we will be involved in our own communications to improve the communication, especially to the Spanish-speaking audience that always seems to be the last to hear about information. And I know that CDC and other agencies are also involved in a major communication effort. CDC released 2 dashboards, respiratory virus hospitalization surveillance network, interactive dashboard, and an emergency department visit data for multiple respiratory diseases dashboard that are related to what we're talking about today. The Food and Drug Administration is expected to decide by spring whether to approve Pfizer's vaccine to prevent respiratory syncytial virus, or RSV, in adults age 60 and older. FDA is also proposing a once-a-year regimen for coronavirus immunizations, a shift from the agency's previous strategy of pressing for new boosters to fend off differing variants. This would be more in line with how the country deals with the virus of influenza and pneumococcal pneumonia. Vaccination in the Latino community is still a problem, and that's why we are engaged in Vaccinate for All, and encourage our members and others to join us as champions, and we'll talk about that later. And 2 years after FDA's COVID vaccine approval, Hispanic people have been less likely than their white counterparts to receive a vaccine, according to Kaiser Family Foundation and others. And once Medicaid terminations resume, the majority of those who will lose coverage will be people of color. Over 4 million Latinos, 2 million African Americans, and over 5 million children will lose Medicaid, and 3/4 of whom will remain eligible, but terminated because we're going to see this month-to-month deadlines, which we used to call churning. Anyway, let me move on to our illustrious panel here. And our first speaker is Dr. Cameron Webb, Senior Advisor to the White House and in charge of the COVID-19 response team. Dr. Webb, it's always a pleasure. We'd be happy to have you present to our audience, and thank you very much for your time.
Well, thanks so much, Dr. Rios. It's great to be with you again, and thank you all for joining. This is such an important conversation, and as Dr. Rios mentioned, my role on the COVID response team is as a senior advisor, and in part, a lot of my focus over the last 2+ years in this role has been on ensuring an equitable COVID-19 response from a federal perspective, which requires a lot of engagement and coordination across the states, across localities, just to make sure we're trying to get the resources where they need to go to help keep people safe. And so, for this webinar, for this conversation, really wanted to touch in a little bit on, from a federal perspective, how things have been looking and where we have opportunities to continue to improve. Dr. Rios just mentioned the president announced last week that the public health emergency, we're planning to end that on May 11th. And I want to make sure everybody knows that by no stretch are we saying that COVID is over on May 11th, right? What we're saying is that it's a shift in the federal approach to how we respond, but we still have, we're doing a tremendous amount of work to make sure that at all times we're still getting the right resources to the communities who need them. And as I'll talk about as we go, communities of color, and in particular, if you look at the Latino community, has been disproportionately harmed by COVID since the beginning. And so it's so important to us to make sure that along the way, we get this right. If you advance to the next slide, I want to start by talking a little bit about some of the challenges that we are seeing. If you look at kind of ensuring equitable access to COVID-19 resources, or as we call them, medical countermeasures in a lot of instances, there are a couple of data points that I wanted to just flag for you as we jump into this conversation. And the first is that people who identify as Hispanic or Latino are nearly twice as likely to be hospitalized with COVID-19. It's about 1.8 times as likely. That's a number in aggregate, since COVID first arrived back in 2020 through today. And it's important to note because we're still seeing that gap. We haven't made up that difference when you compare it to non-Hispanic white individuals. And then similarly, that rate is about 1.7 times as likely to die from COVID-19. And as we've all heard, there are a lot of different reasons that feed into that, ranging from the rates of chronic diseases, rates of exposures, who our essential workers are, where people's living situations, how many people are in the home. If you look at where people are working, there's so many different dynamics. If you think about the range of social drivers of health and the so-called social determinants of health. But still, what this tells us is that those gaps are things that we need to continue to address. And what's so critical is that we have tools to address this in January, February of 2022 that we just, or 2023 rather, that we just quite frankly didn't have in those earliest days. And many of you may remember in 2020 and the beginning of 2021, those rates were 4 times as likely to be hospitalized, 3.5 times as likely to die. So we saw very different rates early on. We've seen some improvement in part because of these medical countermeasures, but we still have a way to go. You see, if you look at kind of the next box there, patients who identify as Hispanic are nearly 30% less likely to receive outpatient antiviral treatments. Those are treatments like Paxlovid or Molnupiravir, and these are treatments, oral treatments that people can take that can prevent hospitalization, that can prevent death, as you all know. So important, and we think about what are those factors that are driving why people are less likely to receive it. Well, one is there's a timeline. You've got 5 days from the onset of symptoms to when you can take these medications. how you can access the healthcare system and providers who are ready to prescribe, know to prescribe to you. That's so important. And we've done a lot of surveys, had a lot of conversations with providers to figure out where they are in terms of prescribing these medications. And we're seeing there are still some gaps in terms of practice patterns on who's prescribing these medications to patients, who they perceive as having the risk. You know, for a lot of people, they're saying, well, their provider said they're not sick enough with COVID-19 to get the treatment. But we know that the treatment is specifically to keep people from getting really sick from COVID-19. And we're seeing that playing out along these racial and ethnic lines, and particularly C. That's a big difference, 30% less likely to receive these treatments. And there's a lot that we're doing to try to correct that. Next, you know, adults who identify as Hispanic and Latino are more than half as likely to be up to date with their COVID vaccines than adults who identify as non-Hispanic white. Just today, Dr. Rios mentioned the Kaiser Family Foundation. Just today, they released their most recent version of the vaccine monitor. Every month, they talk about who's been vaccinated and what are those trends. And we know there's still a lot of room to go in terms of getting folks up to date with their vaccines. The bivalent vaccines, it's hard to call them, you know, the new vaccines anymore. They've been out since the beginning of September, but we still have seen these gaps by race and ethnicity. We're seeing that Latino adults are less likely to have received those shots, and particularly if you're looking at folks who are between 50 and 64 and folks who are 65 plus. You know, that's a lot of individuals who should certainly get that vaccine, because just by age alone, that's 13 million people, I believe, roughly. And so just by age alone, they're more likely to be at risk for severe COVID, even if they've had a shot before or 2 shots before or previous infection. That risk is greater with age, and so we have to make sure that we're getting folks up to date with vaccination. And as the Kaiser Vaccine Monitor told us today, a lot of times what people are saying is they didn't know that they needed another vaccine, or they thought that the protection they had from a prior infection or prior vaccination should have done the trick, should have been enough, right? There's more that we need to do. So as what's really clear is that patients don't always know their risk for severe illness. They don't know the treatment that's available. They don't know the treatment really has to begin within days of symptom onset. And that's just with treatment specifically. With vaccines, you know, they don't necessarily know that the vaccines are so critical to keeping them safe, that there's a new updated vaccine that's more tailored to some of the strains that we've seen circulating. There's a great piece in the New York Times today that kind of talked about how there's still some confusion about these new vaccines, but also talked about the fact that the data is strong in terms of their safety, in terms of their efficacy, particularly for older individuals. And again, we're talking about 13 million Latino adults over the age of 50 who should have these vaccines, who should get these treatments were they to have COVID-19, and we have to make sure that we're reaching them all. You know, and just a word on that idea of severe COVID-19 and who's at risk. We know that risk tracks really closely with age, but we also know that it tracks really closely with chronic disease. And so when you think about communities of color, when you think about the Latino community, we know that people have cardiovascular disease, like high blood pressure, earlier. It doesn't wait until you're 50 in communities of color. Same is true with diabetes, right? It's not waiting until you're older. We're seeing that in people in their mid-30s, late 30s, early 40s, or even younger sometimes. And those are risk factors. Obesity, certainly a risk factor. Asthma and COPD. We think about the range of medical conditions that factor in. Pregnancy is one, right? Puts people at risk for severe COVID-19. And what are we communicating in communities to make sure people stay safe? I'm going to go ahead to the next slide and talk a little bit about how we're approaching that from a federal perspective in this federal campaign, the public education campaign that we've had around, you know, since the beginning of this administration. You know, we've really been pushing on this idea that, you know, yes, it's branded as a We Can Do This campaign, but more importantly, it's about getting the right information to the right individuals at the right time, making sure that information is really breaking through. And so there are a lot of different materials available at the website. And so, if you go back, yeah, perfect. And so, you know, a lot of different materials. One is talking points specifically for providers, you know, and just to say a word there, they're both available in English and in Spanish, but they walk you through exactly how to talk about treatments and also vaccines with your patients. I understand that for folks who've been in the trenches doing this work, you've been talking to patients about this since the beginning, but it's always helpful as a clinician, and I'm a practicing internist myself, it's always helpful to check in and say, what are the latest points that folks are making? What is the data telling me that I should be sharing with patients to make sure they're ready to go? They have the information they need to make really informed and thoughtful decisions. So yes, talking points for providers, handouts specifically for patients, posters that you can put up in waiting rooms or in other clinical spaces, and then also materials for social media. If you have, an active patient population on social media who may consume some information from you there, that's another great place where you can share information. And all these educational materials are made really through deep engagement, making sure we're getting the best information back on how we can connect with communities. And as I heard one colleague say the other day, from an organization of promotores, they were like, we want to meet people where they are, but we don't want to leave them there, right? And we want to make sure that we're moving folks forward with the information that we have that's so important. And these co-branded patient education materials, you see at the bottom of the slide there, NHMAMD.org/we-can-do-this, this idea of putting together the We Can Do This campaign and the brand, the recognition, the awareness and the trust that people have in the National Hispanic Medical Association. When you put those things together, it starts to get people to open their minds a little bit to the ongoing conversation about vaccines. And just want to also be clear, as people are hearing things like the public health emergencies ending on May 11th, that they may not know the exact date, but they may have seen a news clip or a headline or come across something that said, something about COVID and something ending in a few months. We've got to really correct that course and make sure people know what it means. Know that they still need to stay up to date. They still need to have access to these resources. They still need to have tests so they can know if they have COVID-19. They still need to be aware of what dynamics look like with the spread of illness. If we look at our most recent data, we're seeing more cases in the Latino community than we're seeing in other communities in some places. And so what are we doing to make sure that with every case comes at least a conversation about treatment? With every case, there's a conversation about treatment, because that one case may be connected to other family members who may have different risk profiles. And so every time we see or hear that someone has COVID-19, how do we make sure that we connect that with these tools that are really saving lives and keeping people safe? And they're available, they're free, they're accessible, and we want to make sure we take full advantage of that now, because again, those are dynamics that aren't usually the case in our healthcare system. And so we're working hard to make sure that everybody still has access to those after the public health emergency ends. We want to make sure people take advantage of it right now, while there are still, across the country, 400 to 500 people each day who are dying from COVID-19. So it's not done with us yet. We're always thinking about the best way, the best approach federally to address it. I know states are doing the same thing, and local health departments, localities are doing the same thing. But it's going to require us to continue to lean into the best tools that we have to make sure that we stay as effective as we can be. I think the last thing that I'll say is that this We Can Do This campaign, it is a robust campaign with lots of different pieces. Certainly we have the television ads, and we brand those and we make sure that those are both culturally and linguistically appropriate, and we make sure that we're getting those into markets where they can have the biggest impact. We also have social media resources. We're on radio, we're in different places, we're connecting with people, spreading information through local trusted messengers such as yourselves. That is, as a whole, what this campaign is. But what's really important is that it always benefits from feedback, from insights from folks on the ground like yourselves. So I just want to close by saying thank you for all of your work, for all of your effort, and your continued engagement around this issue. It's something that has impacted so many people, and we want to continue to make sure that we're in the best position to keep our communities safe. And so with that, I want to thank you for the time, Dr. Rios. I'll pass it back over to you, and I'll stick around for the Q&A a little bit later.
Oh, great. And just a reminder to everyone, Dr. Webb has done an outstanding job at the White House, being a leader for us, for all our communities and for all Americans, on getting the word out and listening to groups like this. So you need to ask him some questions. Put them in the Q&A box so we can get some questions for Dr. Webb. Now I want to turn it to one of our NHMA leaders, one of our fellows. We have an NHMA Leadership Fellowship Program. I have to put a plug in, Trini. For the fellowship program, we're actively looking for young Latino doctors in their mid-careers who want to be leaders. We bring them to Washington, D.C. We bring them together, up to 20 doctors a year. And if you are any at all interested, please let us know. And I'm sure Trini can also put in a plug for her experience as a leadership fellow. But let me just introduce her. She is the Deputy Health Officer for Fresno County Department of Public Health, which is Central Valley, California, with a lot of immigrants, a lot of migrant workers, but also it's a growing community. And I really have to, my hat's off to you, Dr. Solis, for being a leader for our community from the Public Health Department. We need more leaders like you because, our communities demand more culturally relevant programming in public health. So thank you very much for being here today.
Great. Thank you for the introduction, Dr. Rios. And good afternoon, everyone. As Dr. Rios said, I'm the Deputy Health Officer in Fresno County. And Fresno County is a mixture of rural areas and also metropolitan areas. I'm a family medicine doctor by training, and as she mentioned, I'm also doing public health. And so during the pandemic, I've done a mixture of seeing patients via telehealth and also precepting or teaching family medicine residents in the area. And then I've also worked at the health department. So for my part, I wanted to share more of a local perspective and how we can better disseminate these materials that Dr. Webb was sharing with us about the COVID treatments, how we can get them out to physicians, to patients, and some tools that we use in our department to help disseminate that. Next slide. So first I wanted to talk about some suggestions on how we can get these very important materials that HHS has developed about COVID treatments to our physicians. So some strategies that we utilize in our region is, number one, as I mentioned, I work at that local health department. So a lot of local health departments have email listservs where for the physicians, many health officers have monthly or quarterly meetings with their physicians where they update them on the latest information going on with COVID or other infectious diseases. So that is one method. So for any physicians that are listening in today, that would be one suggestion I have is you can reach out to your local health department, share these materials that Dr. Webb presented. That way they can be disseminated to other physicians in your region, and also being involved with local and state medical societies. So we know that many physicians are involved with their either via their specialty or like state medical society to disseminate information. So just to give you an example, in my region, they have a medical society for the Fresno area physicians, and that includes different specialties. So I'm a family medicine doctor, but they also have specialties in other areas, and that's another way of disseminating information. So if you're a member of a medical society in your region, again, another way to reach out, so you can let them know about these materials. And health plans. So by health plans, I'm talking about health insurance plans. A lot of ways we reach our doctors is also by contacting our local health plans, and they disseminate information to their physician members. So that's some ways to reach out to your local physicians to disseminate these materials. But I do want to stress the importance of also educating our physicians about prescribing these COVID treatments. As Dr. Webb was saying that, there is a disparity in the utilization of these treatments by patients, but I also want to stress the importance that also having doctors prescribing these medications. As Dr. Rios mentioned, I am currently doing a fellowship through the National Hispanic Medical Association. Definitely recommend it for any physician right now, that NHMA physician that's interested in it. But part of that fellowship, we're in different cohorts. And so I'm in a group where we look at, we're actually looking at COVID treatment utilization, and I'm paired with physicians from all around the country. And in our discussions, we talk about how sometimes we see our other physician colleagues who are hesitant or have questions about the, utilizing at prescribing the COVID treatment. So I do want to put a plug that for any physician out there that hasn't yet, a primary care physician that hasn't yet prescribed these treatments, to please reach out to your local health department. We have a lot of toolkits available that may answer your questions about drug interaction tools, consultation lines. I know here in California, the state health department has a consultation line for physicians if they have questions, because we want to support our physicians and being able to prescribe as well. So that is an important thing I wanted to mention about we're available to assist at the local level. And one other thing with that is that some physicians have reached out asking about becoming a test to treat site. And so just to clarify, test to treat sites, that's where an individual can go. If they have COVID symptoms, they get tested, they'll be evaluated by a healthcare provider. And if they are eligible, they'll be prescribed with treatments right then and there. So if a clinic, if you're a physician in a clinic and you want to become a test to treat site, meaning you'll get treatments right then and there. That way your patients don't have to go to a separate pharmacy to pick up treatment. They can get it right then and there. Because as Dr. Webb was saying, you want to get it within those first 5 days of having symptoms and start taking those medications to be more effective. So if you're in a clinic right now and want to become a test to treat site, you can reach out to your local health department. They can help you get that set up. So just wanted to put that plug in because, again, I live in a county where there's rural areas and sometimes patients have difficulty with transportation, and having a prescription where they'll have to drive to a different pharmacy can be difficult. But having the medications right there, it can be very helpful in lowering those barriers to accessing the treatment. Next slide. And so here are some suggestions that I have for sharing these materials for with patients in our community. And so again, what I've seen be successful in our area is when physicians and other healthcare providers share materials about COVID, either vaccines, or here we're talking about treatments and clinic waiting rooms. Urgent care waiting rooms as well, and emergency rooms. So we know as patients wait, for the doctor to wait to be seen by the doctor, that they can have some materials ready there and available for them to read in English and Spanish, and also electronic medical records. So as providers, you can disseminate some of these information through your electronic medical records. So a lot of patients, after they're seen, they get an after visit summary. So your hospital system may call it differently, but it's really just a general summary or medications prescribed or some recommendations you may write for them. And so with that, like where I was trained, they call the after visit summary, and same for when I've seen patients in my area. And really that's an area where you can put links. So you can put some links for the HHS materials for individuals that are high risk. So those risk factors that Dr. Webb was saying about being obese or older age, or, having chronic diseases like diabetes, high blood pressure. So for those patients, it might be helpful to put some links. That way they're aware and have a plan. Because I always tell patients in the community, it's always good to have a plan. If you were to get COVID, what would you do? And obviously the best way to prevent that is the vaccines, but good to have a plan, because even now I still get questions like, okay, I got COVID, what treatment should I get? Can I get the monoclonal antibodies? And so COVID treatments are constantly changing. And just to be clear, the monoclonal antibodies are no longer effective against the current variants. So it's more like Dr. Webb was saying, that the oral antiviral pills are more easily accessible, as he was mentioning, the Paxlovid or Molnupiravir. But yeah, so that I'm just sharing about the electronic medical records, because when I was teaching family medicine residents during the pandemic, I advise them, okay, develop a smart phrase, put it in English and Spanish for your patients as they're leaving the clinic visit. That way they just have that information. And as we've been talking about the importance of utilizing our community health workers, I've seen how helpful they've been during the pandemic. They've really helped us in our region disseminate COVID materials in different languages, and they're just very trusted community. So as physicians, we're also trusted members in the community, but so are community health workers. And so really, if you're a community health worker listening to the call, just, we appreciate your help, and using and collaborating is what I'm trying to say, collaborating with our community health workers to disseminate these materials. So for any community health workers, if you can help help us disseminate these materials. That's another way that we can reach our vulnerable community. Next slide. And then I wanted to discuss some how to promote some COVID prevention measures. So we've been talking about treatment, which is super important, but also it's important to also talk about the prevention. So these are some tips that, as we've seen throughout the whole pandemic, it's always important to repeat them and make sure that we're all sending the same message. But number one, I always talk to my patients and the community about the importance of getting vaccinated and boosted, especially with this new updated bivalent vaccine. Wearing a mask, washing your hands, staying at home if you're sick, and get tested. So those are the same, precautions that not only for COVID, but also, as we were talking earlier, flu, RSV, all these other winter viruses that are circulating. Really, these help us protect ourselves. And how do we get the word out about the prevention? So same thing as we've been talking about with the treatment, vaccination campaigns. So as Dr. Rios was saying, NHMA has a Vaccinate for All campaign for any physician who's interested in really getting the word out in their community via different media, such as TV, radio. And I've also been part of that campaign. And again, really helpful in getting the word out in our community, because we want to have different ways of reaching our community, and also utilizing social media. So if you're a doctor in a clinic and you want to, talk to your clinic administrators, and perhaps you can put some more social media for your clinic organization, or if you're in a hospital, an emergency room doctor. So there's different ways you can get the word out via your social media. But again, Dr. Webb provided us some so the HHS materials have already made social media blurbs for you to share. So already very convenient. And from my experience of also with working at the health department, utilizing social media, it's just been super helpful to disseminate the information, and also combating misinformation. So I know during the pandemic, I'm still seeing it. So many myths circulating, not only about the vaccines, but also hesitation about the treatments and concern about side effects. And so, when I talk with patients, I also hear a lot about myths and try to disseminate that. But just know that utilizing media is a very powerful tool in helping push prevention and also treatment options. And so there's different ways to get involved, as Dr. Rios said earlier. And then, as we've been doing in the pandemic, making the vaccines easily available in local clinics, community events. And so just to share, so I'm really involved with helping coordinate vaccinating farm workers in our region. So Fresno County has, I believe, the largest amount of farm workers in the state of California. So we've done a lot of work of making COVID vaccines available to farm workers at the workplace, and we found that to be really successful. And because of that, it really planted seeds for us to offer now more than just COVID vaccines at the workplace, because as Dr. Webb mentioned, COVID-19, those individuals that are more high at risk of being hospitalized or dying are the ones that have the chronic diseases, the obesity, and so forth. And so now we are launching a program next week in our region where, besides COVID and flu vaccines, we're going to be doing glucose checks, blood pressure checks, checking BMI, body mass index, and that's how we can determine if someone is obese or not. And so I'm just sharing that it's very important to also, not only get your vaccines, but also staying healthy, getting your physical. As a family doctor, we really focus on prevention and getting your physicals and making sure you're up to date with your routine health screenings, because all of that will protect you against those really concerning outcomes, such as hospitalization and death that can be caused by COVID. And lastly, leading by example. So another way to promote these prevention measures is leading by example, meaning, for example, when I got my COVID vaccine, I took pictures, I posted it, like my health department, we posted it on our website. So if for any physicians out there, again, you can work with your clinic administrators or hospitals or whatever type of setting you work at. That way you can promote it via that. And whenever I'm in the out in the community and it's like a crowded public indoor setting, I'm wearing my mask because I know they help. And so I just know it's really important for us to not only practice it ourselves, but show the community that we're following it. And this is why we're recommending it, because the science shows that these prevention tips are very effective. Next slide. And last, I just wanted to share a picture with you all about an example of meeting the community of where they're at. And so this was, during the pandemic, I was helping not only coordinate COVID vaccine events at agricultural employer like work sites, but also I helped monitor for side effects after the vaccine was given, and also educating the patients, the individuals getting the vaccine about the importance of the vaccine, but also I would share, hey, now that you're getting this vaccine, share this information with your families, with your friends, because really that's another way to combat misinformation, because they can let them know, hey, I was fine, I got the vaccine, I didn't have major side effects or anything like that. So again, just sharing an example of how this is another way to pass out materials. As you can see, I don't know if you can see that close in the pictures, but they're holding some educational materials that we passed out to them. So another opportunity to disseminate such materials that we discussed today. And yeah, I think that's it for my part, for my presentation, and I'll turn it back to you, Dr. Rios.
Okay, I thank you, Dr. Solis. Let me get this side by side here. So thank you, both of you. We have some questions. If you want to come back on, Dr. Webb, thank you. And I want to thank everybody for asking the questions. Let me start with Dr. Solis, since you just talked about all these great ideas. Your experience is highly valuable, being a Latina doctor working in Fresno's public health departments. The questions that have come up have to do with communication that you didn't mention. And if you could just tell us what you think and how you see it being used from your vantage point. One is texting. So given the lack of broadband and the digital divide with our communities, especially elderly not having computers, we know that there's been success, the HRSA's agencies, maternal child health texting, for example, but are you using texting messages in your campaigns in Fresno?
So we are collaborating with the state of California's health department, and they do utilize texting. They use WhatsApp. So from their research, they found that a lot of Latinos utilize WhatsApp. And so they've crafted it's really like Q&A. So someone can ask a question in Spanish in a text, and then it'll be auto-populated response in Spanish. So if they have a question about a vaccine, it'll get a response. So through that, we have been promoting that app that the state health department has developed. So we have heard that that's helpful as well, because as you mentioned, there's some individuals that feel more comfortable via text, and so we work with the state health department to offer that.
Great. Another set of questions actually for Dr. Webb, and let me paraphrase this because I think it is very important for people to understand your answers coming from the Biden administration at the time that this pandemic is actually coming to an end in terms of a public health emergency. It's not going to end. We know the COVID infection, the virus, and causing the diseases, especially in our communities, is not going to stop. So people are worried, and what answers do you have to our audience so they can tell others about the importance of the end having a result that is going to be seen as having a problem that's going to be called affordability. I mean, that is called affordability. The Latino community is the one ethnic group that has the most uninsured. And yes, insurance companies will pay for treatments and vaccines. But what about people that don't have insurance? And then we have undocumented who are fearful as it is of of going to community health centers or places where you might think you'd get access to treatment. And so, Dr. Webb, what would you say? We need to start thinking of what should be the some of the messaging to our communities that would be positive.
Well, even before we get into messaging, I just want to say a few things. And the first is that, the end of the public health emergency, I want to again reiterate, doesn't mean the end of the pandemic. I think that what we're doing could best be described as kind of shifting it from having a separate focus and, here's me saying I'm probably not going to have a job in the White House doing this 6 months from now. And that's a good thing because it means that we're moving this work into agencies like Health and Human Services, into components of the CDC, where it can live on indefinitely as a part of kind of a formal structure. So it's really kind of a reorganization more than it is an absolute end to the response in general. The other thing is that there are certain dynamics with the public health emergency that give some special allowances. And I think that's the thing that speaking of my employment, that's the thing that's the reason why I'm still working, right? We're working overtime to make sure that we're filling those gaps, make sure we're addressing those dynamics for folks so that, we're really not leaving people behind. But this is really a commentary on a bigger issue than COVID-19 and the public health emergency, because the end of the public health emergency means that COVID becomes a part of our healthcare system. And what we're all talking about, and the gaps that you're describing, are gaps that exist for every condition in our healthcare system that disadvantage our communities and have done so for generations, right? And so if we can take this moment and say, this isn't fair, it's not right, it doesn't just harm this community, it harms all of society. That's the argument we've made for the last few years with COVID, right? We have to continue that conversation. So I think this is a part of a broader conversation about the American healthcare system and who it serves and how it serves. And the other realistic dynamic here is that we quite frankly don't have money to run the COVID response in the way that we've been running it indefinitely. We've asked time and time again for additional funding for Congress to continue the COVID response, and Congress decided not to fund that. And so we can't keep offering free vaccines, free treatments, free tests. That's something that we just would need money to be able to do. And that's something that Congress, in fact, last week, Congress, the new Republican-led Congress introduced a bill called the Pandemic is Over bill, right? I mean, there is an effort from Congress to move away from this altogether. And I think the president is really thinking about how can we do this in a thoughtful way that tries not to leave folks behind. And so there'll be more information coming out in the weeks to come, just as we continue to kind of roll out exactly how that's going to look and how we're going to work with communities. But Dr. Rios, I know we're going to stay in touch with NHMA because you've been such an important partner along the way. And so for us, as we continue to kind of develop this, roll this out, and move toward that May deadline, we want to make sure we're engaging with stakeholders and hearing your thoughts on what the most important priorities are.
Sorry, no, I was muted. I do know that the CMS agency at HHS did give the states clear instructions and deadlines, which is this month, for their plans on how they're going to roll out the implementation of this unwinding of the emergency services. And I know for many in the healthcare community, we've seen the expansion of telemedicine and telehealth, and that is going to be a little decreased too, in terms of support. So you're right. The healthcare system, and honestly, I feel wholeheartedly in support of the idea that we all need to take a more critical look at our healthcare system for our communities and try and make policy recommendations to all lawmakers, whether it's state assemblies and senates, governor's offices, as well as Congress and the White House and the administration. There's different ways to make policy changes. We're always commenting on regulations, but it's a shame that the Congress right now is trying to just, stop whatever they can with all the successes of the Biden administration just in 2 years. I mean, there's been so much done and rightly so with the COVID emergency. So I know that we will continue to do what we can to educate, especially the younger folks in colleges and pre-health students that are going to get into the healthcare system. So the next generation of healthcare leaders can be more loudly heard, and work with everyone. Guadalupe Pacheco, I see you just joined us. Guadalupe, did you have a question? And I'm sorry, Guadalupe is working with us on our National Hispanic Health Foundation. And I just want to ask about a specific question, because we are working on how to increase the diversity within the public health workforce on a special grant from CDC that is very, very much on the minds of everyone right now to change the public health, to build the public health infrastructure, but with diversity, so that we can make some changes that Dr. Webb is talking about. Lupe, no?
Yeah, yes, I'm sorry. I just logged in. So Dr. Solis, right?
Yes.
You're the county health department?
Yeah, I'm the deputy health officer for Fresno County.
Oh, wow. I went to Fresno State, by the way,
Oh, wow. Nice.
back in the 70s. But no, I think Elena just mentioned about the project that we're working on. And as I think most of the folks who are on the call, there is an employment disparity among minorities in the public health space, right? And especially in the leadership kind of, I guess, arena. And we know that you have to really be in a leadership position to really drive, I guess, inclusivity, right? To promote diversity. So, we're looking at particular kind of strategies that can be deployed to raise the awareness of the importance of having a diverse staff, especially among minority populations. I mean, minority individuals who are seeking positions in the public health arena. And I guess I was curious how you were able to achieve the position that you're in, you or even Dr. Webb as well, in terms of having mentors or maybe somebody gave you some guidance, or what any kind of ideas that you have would be helpful for us.
Well, I can start. So that's a great question. So I think for me, after college, well, even in college, I was interested in health promotion. I took a lot of classes, and I had mentors that I knew like I wanted to go into medicine, but I had mentors who informed me about the importance of also learning about policy. If you, as you mentioned, want to shape and improve healthcare access. And so after college, I worked in Sacramento, and I did a health fellowship. It was a 1-year program where, and now I'm seeing more programs for college graduates, individuals with masters, especially here in California, where they're trying to promote more exposure to the public health field. So even here in Fresno County, we're going to be taking a fellow and an intern, and it's all set up through the state health department. So for anyone interested in public health who's a recent college graduate or master's, there are a lot of great programs happening throughout different states. But I think for me, just having some experience after college, getting exposed, I saw a lot of doctors in advocating in Sacramento for bills or for different programs. So that for me inspired me, like that I wanted to do a mixture of clinical and admin, which I'm getting to do today. And I also got a master's in public health. So you don't need to have a master's in public health to be a doctor in public health. But for me, I felt it helped me. I met more mentors that way. So really, I think for me is having that exposure early on really helped me in this direction.
Thank you.
Thank you.
Dr. Webb, did you want to answer what helped you get into public health?
Yeah, just a +1 to Dr. Solis' comments. I think it's good mentorship along the way, and I think it's just room where you're planted. I think if you have opportunities to serve your community locally and really engage with people in community, lift up that voice, whether it's in a health system or a local health department or whatever it may be. I think that becomes, an insight that informs work at the state level and becomes insight that informs work at the federal level. But it just starts with, really focusing on passionate commitment to communities.
Great. Well, thank you. Let me go back to the questions on the topic of the treatment issues and communication to our communities. One of the issues, and there's actually a couple of questions about this, but I'm going to put it together, is how do you increase the stakeholders that you work with, both from the White House, which is probably easier to get people to answer your phone calls, but from a public health department too. Was mentioned, two things were mentioned: the pharmacists, the actual role of the pharmacists in our communities, and how do you work to include them in these, implementation of programs. And the second issue is the second group is the religious networks in our communities, and especially, the Catholic Church. Not everybody's Catholic, but, we have a huge presence in the Catholic Church. And there may be other stakeholders. I know, Trini, you mentioned media. We at NHMA, we work with media a lot. And Dr. Webb, I'm sure with your vast experience with in Virginia's lawmakers world too, a state and as well as the federal government. How do you see stakeholders helping us with communication about all of these issues that we talked about today, especially getting to our patients that are most vulnerable to getting more COVID and needing more treatment?
I'm happy to start. I think that you're right. From the White House, people do tend to answer our call, which helps. But I think it really starts with that posture, that the information, the insight from community, from people on the ground who are really doing the work every day. That's going to inform the response the best. And so this public education campaign, that we can do this campaign, is really built with a lot of stakeholder engagement in mind. That's why we've been able to iterate and adjust it as needed to make sure that it's really meeting the needs. It's not going to be an effective campaign if it's not connecting with people on the ground. And you get that feedback through deep stakeholder engagement. A lot of the entities that you described, you mentioned pharmacists, you mentioned faith community, that's kind of core stakeholder work that's part of my role. And so I think we kind of built that in on the front end. The faith community has been essential in the vaccination effort, creating safe, reliable places, and also, allowing folks to hear about the vaccines in a way that's depoliticized. It's one of the few environments in our communities that's often depoliticized, and so I think that's important. Pharmacists, my goodness, heroes of this response in every community. And I think that's something that we really leaned into with the vaccines and are leaning into with the treatments as well. We're always subject to what the FDA says, but I think ultimately we were strong advocates for pharmacists helping get Paxlovid to communities because that gives more people access. And so we've worked with pharmacist organizations as well. So there's a lot that we can do. Dr. Solis kind of mentioned that bottleneck of prescribers, prescribing these oral antivirals or these treatments. But often the challenge is somebody getting in to see their doctor, getting in to see a provider. And if you can go to a local pharmacy with your at-home rapid COVID test and say, I need Paxlovid, and somebody can get it to you, that's a difference, right? And so I think that's something that the FDA actually changed the authorization to make it easier for pharmacists to do that several months back. So there's a lot of engagement that's going to continue to happen. But I think what we always look for is who's not at the table, and how can we get more folks at the table, because there's still a lot of folks we need to reach, and we need to engage to get there.
Dr. Solis, just maybe to complement what Dr. Webb said at the local county public health agency, how do you work with stakeholders? And also I'm going to ask another question. How do you get more doctors to get engaged in your advisory committees? I know that the state health departments, the federal health departments, as well as the county health departments need more, especially Latinos and African Americans and Native American voices in the decision-making tables that you all, you set them up, And so anyway,
Yeah, great question. So just to add a little bit more about the stakeholders, as Dr. Webb was saying, even with working with our churches, I think that was very instrumental with us getting the word out about the vaccine. So not only do we have like COVID vaccine events at churches, like parking lots after mass and so forth, but I've also participated in webinars with priests and pastors, and some of the priests share that their individuals in their church would ask them, should I get the vaccine? So they very highly respected members of the community. And I think just being in those spaces, as we've talked about, like we utilized, that was a social media. It was like a Facebook thing where individuals in the community can listen in. So I think that was helpful, having local leaders from the churches and being in media, and also community-based organizations, the community health workers, as I've been talking about, our doctors. So really just reiterating the importance of having different stakeholders at the table. And to your second question, can you repeat that, Dr. Rios? It was, how do you get more physicians involved, right, in the advisory committees? And
Yeah, I mean, it's another, it's stakeholder connections at a more, a more individual level maybe, but people who represent our communities, the pharmacists, the dentists, the doctors that are in our health professions that, can often, want to get involved. They just don't know how. So.
Yeah, so we've had, so for an individual who has a few hours and they want to, be involved with their local health department, reach out to your local health department. We've had physicians who told us, hey, I have 4 hours a week, like my admin time, I want to get involved. And they were different specialties. So to give you an example, we had an OBGYN who reached out and said, hey, I'm available on Wednesdays. And they are now helping us with our one of our fetal infant like mortality reviews, and it involves like COVID, but it's also substance abuse. So really her passion, and we had a need for that in our department. And we had other physicians that just offer different skill sets. So for any physician out there who's interested in getting more involved in public health, and it doesn't have to be part-time or full-time, even a few hours, feel free to reach out, because we definitely, many health departments could definitely use that help.
Right. Well, I see that our time has come to almost an end. I just like to ask you both for any closing comment. Dr. Webb, closing comment on the importance of reaching our communities and educating them on the importance of these programs that we're talking about today, and getting there.
Sure. Just a quick word there is that I know you've been working incredibly hard these last few years, and because of that, you saved an incredible number of lives. And that burden, I know, weighs heavy, because that's the work that you do every day. And I know we're always asking providers to continue to do that work. And this is one of those moments, right? We've got tools that are going to really continue to save lives, and anything that we can do from the White House to support you and getting the word about that out. Let us know anything we can do from the agency, from HHS. This public education campaign is built to support you, and we want to do just that. And thanks for the time.
Thank you. And Dr. Solis, any last comment?
Yeah, I want to thank everyone who took time from their busy schedules to listen in. I know it's a lot of work to stay on top of what's the latest in COVID. It's constantly changing with the variants and the treatments. And so really, I just want to ask that whatever new information you learned today, the awesome flyers that HHS developed, please disseminate them in your communities, because our education is a critical part of really helping improve COVID in our communities.
So I think I have one last slide. There it is. Please participate. Oh no, wait a minute. The NHMA program update, just to plug again for our conference. We educate all health professionals and others who are interested in learning more about Latino health and the important issues about COVID-19 continued treatment. It will be in Chicago, April 27th through the 30th. We have information on our website that is at no, it's not at the bottom. It's nhmamd.org. And then we have our Vaccinate for All campaign that was mentioned, and the importance of joining as individuals or organizations to join the other 200 that are working with us. And we have a website called hispanichealth.info that has bilingual information, all the information that you heard from today, those and more flyers, from the We Can Do This campaign of HHS is on our HispanicHealth.info. Also, there's the QR codes here to register as a Vaccine for All campaign champion or to register for NHMA upcoming events. And then a reminder, the next slide, the reminder to fill out our survey, post-webinar survey that will be emailed to all who registered today. And you will be able to enter, you're not guaranteed, but you will be able to enter our raffle for a $25 Amazon e-gift card. So with that, I want to thank you very much. National Hispanic Medical Association is proud to bring to you leaders from the White House and from the Fresno County Health Department today, and to partner with We Can Do This and the importance of having health information given to our communities and to counter all the misinformation that's out there. Thank you very much. And thank you to the staff and all who asked questions.